you are a dental hygiene student and you're struggling with the different types of heart conditions, open up your textbooks and let's talk about it. Today's sources are Pickett, so preventing medical emergencies in the dental office. Chapter 11, so we have cardiovascular disease, angina pectoris, myocardial infarction, heart failure, hypertension, cardiac arrhythmias, and congenital heart failure. CVD, this means abnormal function of blood vessels and heart muscles. Risk factors are smoking, family history, diabetes, high cholesterol, obesity, very sedentary lifestyle. That means you sit on your booty a lot. This can lead to hypertension, which is the silent killer, stroke, heart attack, heart failure, and angina. Angina pectoris, pain in the pectoris. This causes reduced oxygen that supplies to the heart, which is often from narrowed arteries, atherosclerosis, with, clogged arteries. There is stable angina. That can be relieved by nitroglycerin. And what is the rule? Only 3 every 5 minutes. And after the first 2 and it's not stable, you will call 911. You give them some aspirin, 325 milligrams, and you send them on their way, give them oxygen. So you have unstable angina. This is more severe, unpredictable, and it can occur even at rest and increases the MI, which is myocardial infarction. So angina is chest pain or pressure that can radiate to the arm and the neck and the jaw. Keep nitroglycerin available. Make sure they have it. Make the stress go down. Short appointment, oxygen, and anxiety control. Avoid elective care if unstable. Okay, next to myocardial infarction / heart attack. This is because of a complete blockage of blood flow to the heart muscle. Tissue death. Symptoms are crushing pain, radiating to the arm, neck, and jaw, shortness of breath, sweating, nausea, and a sense of doom. No elective dental care until 6 months. It says 1 month, but it also says 6 months. They need to be stable. And only emergency care is with a physician consult. And remember, they need to have a cardiac dose, which is 0.04 milligrams of epi, at most 2 carpals. Next, we have heart failure. This is divided into left and right. This is when the heart cannot pump enough blood. The left side fluid backs up into the lungs. So you have shortness of breath. You cannot lie flat. Most of the time, anybody with cardiac issues, you put them up semi-supine. Feels like an elephant's weighing on their chest. So they can have dyspnea / orthopnea, difficulty breathing. So the right side, fluid backs into the extremities. So you're going to have swelling ankles, your feet. So it's edema. They will have blue lips and nail beds. You can treat the right side with diuretics, and the left side you treat with nitroglycerin. And also give them oxygen. Hypertension, the silent killer. Oftentimes you have no symptoms until it's advanced. So you're at an increased risk for a stroke, MI, heart failure, kidney disease, and death. That's why we want to take blood pressure every single time. And if it's not, you need to give them to the primary care provider if it's not, below 160. Anything uncontrolled, you need to postpone and go have them see their PCP. Okay, cardiac arrhythmias. You'll have tachycardia, bradycardia, atrial fibrillation. That's the most common. Or ventricular fibrillation. That is a medical emergency. Heart disease can cause this, drugs, and electrolyte imbalances. So people who have anorexia can get cardiac arrhythmias. Irregular heartbeats. Most of the time, patients who have cardiac arrhythmias have pacemakers. Any pacemaker made before 2000s needs to not be treated with an ultrasonic cavitron, okay? Also, make sure they have their INR, okay? Needs to be between 2 to 3.5. And with the pacemaker, it needs to be shielded. Okay, congenital heart disease. Congenital meaning you're born with. Your heart structure developed during in utero. Some children with Down syndrome have this. So you can have ventricle septal defect, atrial septal defect, or tetralogy of Fallot. So ventricle, there is a hole in the wall between the 2 ventricles, the lower part of the heart. Basically, oxygenated blood in the left ventricle flows deoxygenated blood to the right ventricle. So this causes extra blood to go into the lungs and overworks the heart and lungs. Atrial, there's another hole in the septum, the wall of the atrials, the upper heart chamber compartment. Oxygenated blood in the left atrium basically starts to mix with the deoxygenated blood in the right atrium. Oh my gosh. Mix with the deoxygenated blood in the right atrium. It's less severe than the ventricle and can often be asymptomatic in childhood and can go undetected. And with the tetralogy, I don't know how to say it, of Fallot, TOF, this is basically a very complex congenital heart defect with 4 abnormalities. You can have the ventral septal defect, pulmonary stenosis, narrow pulmonary artery or valve, overriding aorta. The aorta is positioned over both ventricles, and right ventricular hypertrophy, thickened right ventricle. So this can cause low oxygen, making the baby blue, cyanosis, poor blood flow to the lungs, which means mixed oxygen, so oxygen poor blood in the body. It can also lead to clubbing fingers and toes. And for all of these, lots of fatigue. Okay, well, thanks for studying with me. I'll see you guys later. Good luck studying. Bye.